Now, there's a lot in the news about how COVID-19 is worst in or affects the elderly the most, especially those with pre-existing medical conditions.
Very spot on this one. However, there seems to be less cases of kids, babies, and pregnant mothers in isolation or receiving treatment in most Nigerian news. Thus, some experts say that it seems kids, including teens, have the lowest risk of dying from COVID-19 out of all the age groups and have lower rates of illnesses at more severe end of the spectrum. How true is this? Is yet to be properly ascertained scientifically.
Indeed, and joining us now to discuss the effect of coronavirus on maternal and child health is Dr. Alero Roberts, a consultant in public health and senior lecturer in maternal and child health at the College of Medicine, University of Lagos. Thank you so much for joining us, Doctor, this morning. Let me be asking you, I mean, a Chinese newborn on the 2nd of February was born in Wuhan and tested positive to coronavirus. On the 14th of March in the UK, North Middlesex Hospital, a newborn tested positive a few minutes after birth. And here in Nigeria, about 2 weeks ago, a 6-week-old baby was also tested positive for coronavirus. I know there's a lot we don't know about coronavirus, but if you could hazard a guess professionally, how would you say these infants are being infected? Is it before or during birth?
Thank you very much for having me. The truth of the matter is you're very correct. We don't have the research evidence to show exactly how these babies are being infected. The conjecture is that they're being infected either during or shortly after birth, either from a mother who's been infected or a health worker who's been infected. I believe that the case in the UK was from an infected health worker who eventually had tested positive for the coronavirus. The truth of the matter is that neither pregnant women, newborn mothers, nor newborn babies are any less at risk of coronavirus than anybody else. Neither are they any more at risk at coronavirus. That is to say, the risk of contracting coronavirus is the same. Whether they're old, they're young, they're new mothers, they're pregnant mothers, they're unpregnant mothers, it doesn't really matter. This seems to be an equal opportunity viral pandemic that is affecting everybody. Of course, we know that it affects some people to a greater or lesser extent, depending on their age, their other underlying illnesses that may be there. And also we're learning about the viral load, which is why frontline healthcare workers seem to be most at risk.
All right, I want to talk a little bit about the presentation of, children with coronavirus and the after effect. You know why I say this? I say this because if you cast your mind back, a couple of years back now, we had a certain virus out of Brazil called the Zika virus, and it presented with sort of like, brain challenges for the children and the like. So what has been the presentation like, and does it have an after effect, a lingering effect of some sort on children?
Again, the jury is still out on lingering effects for anybody concerning the coronavirus. So far, it does not seem to have, if we're looking at those who have recovered from the virus in places like China, it does not seem to have much lasting effect, but the jury is still out. The research still has to come in for us to know. But certainly we can say that so far it doesn't seem to have the same devastating presentation as the Zika virus did, with that devastating mental health challenge, intellectual challenges that it caused. So the coronavirus presentation in babies, I believe, is the desaturation. The oxygen levels go down a bit. There's a fever. Sometimes there isn't always a fever, and there is some respiratory challenges. But that is neither here nor there, because we've only had evidence of a very few cases, so it's difficult to say this or that is the case definition for coronavirus in neonates and children.
Indeed, and that brings me to my next question, because when you look at confirmed cases globally, the numbers in children are very low. And I wonder what the explanation to that is. Is it that the children are not getting it at all, or they're not exhibiting symptoms? What do you think this is?
Very good question. We're not actually sure, but we do know that the children who do test positive for coronavirus tend to exhibit very mild symptoms. However, that is assuming, of course, there are no other underlying illnesses that could cause them to become more serious. We know that there is a problem with children who have asthma, for instance. So they are more likely to develop very serious symptoms. And we have seen 1 or 2 deaths in rather young people who did have these underlying illnesses. So we're not really sure yet. Like I said, this is a very, very new virus that we're dealing with, and all the research is going on around the world, I must say, in a very collective manner to get us as many answers as possible.
That brings me to a lot of children out there in the world dealing with the scourge of cancer. I mean, how can we protect children like this with this coronavirus going on all around the world?
You find that in countries like the US, they have managed, and the UK, I believe, they're trying now to separate people who are ill with illnesses other than or unrelated to the COVID-19, and then separating them from people who are ill with COVID-19. Because when you get into a hospital, nobody goes to a hospital as a form of entertainment. If you're going to a hospital, you're already vulnerable. You're already ill, there's already something wrong with you, and therefore the last thing you need is some kind of nosocomial transmission of coronavirus, and then you get COVID-19 on top of your problems. So there is a need to distance, to separate patients who have other unrelated illnesses, and certainly patients who have illnesses that make them even more vulnerable to any illness that will give them massive respiratory challenges like COVID-19 does.
And so I'd like to bring in the mothers into this. Should pregnant women start to worry about coronavirus? And then let's touch a bit on the immune of newborns and children. Is this, I mean, sort of reprieve for them? How does their immune fight a virus such as COVID-19?
Well, for a start, for pregnant mothers, what we advise is that you need to be talking to your care team, your birth team, and this is a time to set up a remote connection with them and have them talk to you over video chats, connect with them, and they connect with you, so that you have and then make your birth plans. I know we have a lot of pregnant mothers who are in one place right now and have chosen or planned to give birth in other places. So there's a great deal of birth preparedness that needs to be taking place right now, and you need to be doing that. Pregnant women need to be doing that with their care team so that they have all the assurances that they need. They also need to be much, much closer, not socially, of course, but much, much closer, connecting with other members of their family, their neighbors and friends, so that when they do need assistance, they have a team of people that they can call on, either with assistance with other younger children, assistance with shopping and getting food preparations done in the house, assistance with transportation to and from health facilities should they need it. Then if you've got a birth plan, this is the time to check that birth plan out with your care team, make sure that you can still carry on that birth plan even if there's a restriction on movement such as we're experiencing now. And then of course the financial aspect of it. This is the time to have a financial plan, and if you haven't got one in place, to set one up, even if it's a very local plan, contributing to a common purse to make sure that there's some funds available for you should you need it in an emergency. Concerning the immune status of mothers and children, like I was said earlier, assume that you are just as much at risk of catching coronavirus as anybody else in the society. So certainly you need to be eating very well to make sure that your immune system is up to par, lots of fruits and vegetables, lots of fresh nutrient empty foods, so that you make sure that your immune status is operating at its optimal best, both for you, your family, your children, other younger children in the house. And stay away from people as much as possible. Do practice the social distancing. Hand washing, we cannot emphasize that enough. Hand washing, and I think if you'll notice, if you've been watching me, I've been very, very careful not to touch my face, not to scratch the itch on the edge of my nose. It's very important to teach children and everybody around you to do these seemingly simple and mundane acts, which are definitely proving very, very useful in stemming the transmission of coronavirus.
Real quickly, I'd like to talk a little bit about the stats among more men than women catching this At first, I'm sure the myth of, oh, it used to be something of the West has been debunked now because we have cases here. I also want to talk about a critical group of people. I mean, I know of people that might have had transplant, like a kidney transplant, and they have to use some immunosuppressants and the likes. What happens to them in a season like that? And you react to more men than women. I mean, these are just stats. We're learning about this.
Yes, we have heard the stats about more men than women. I believe it's more of a, that's a personal belief. Of course, it hasn't been tested by research, but it's probably a case of exposure, more likely to be a case of exposure than anything. But like I keep saying, the jury is still out. A lot of research is going on and will still need to be done to be actually determine what exactly it is about the novel coronavirus that has turned it into what we are seeing today. Who is more prone, who is less prone. Concerning the other issue that you raised, now remind me, the issue of people who have had kidney transplants, again, it comes back to vulnerability. And certainly, you know, if anybody has had to have a kidney transplant or recent organ transplant, I believe the hospitals involved and the care teams involved are being absolutely very, very careful to ensure that they do not put those patients at risk of exposure to any form of coronavirus in any which way. So if they start limiting visitations to the hospital, certainly visitations to the patient's room, I will not be surprised at all. It's very, very, very important that people with compromised immune systems be protected even more than other members of the society.
Dr. Ann Roberts, stay with us. We'll go on a quick break. When we come back, we'll talk about an important component of the containment plan, which is testing. Stay with us, everyone. We'll be right back here on The Morning Show. Welcome back to The Morning Show here on the Rise News. Dr. Alero Roberts, a consultant in public health and senior lecturer in Maternal and Child Health at the College of Medicine, University of Lagos, is still with us. Thank you so much, Doctor, for staying with us. Let me ask you about the component of containment, which is testing, because I do know that you have been involved in research as regards patient testing or rapid test kits for malaria. But at a time where the world is in short supply for test kits for coronavirus, first, is that something you're doing? Is there research going on for that? And secondly, what's your take on the issue of rapid tests not being reliable for coronavirus? And this has been said over time by Nigerian health authorities, saying we have to depend on molecular lab testing for now. And the turnaround time for those test results do take longer.
Well, that's a very loaded question, but the truth of the matter is that right now, a lot of research is going on into developing rapid test kits, because certainly that is going to make a major, major difference in able to quickly diagnose and manage anybody who has been exposed to the coronavirus. But as of today, and I've just checked again, neither WHO nor NCDC have approved any test kits for rapid diagnosis. There are some test kits I know that are going around. So many people have sent me pictures of little cassettes of test kits that you just put a drop of blood in, very similar to what we use for the malaria rapid diagnostic test. But they just look for, in fact, one can't even be sure of the authenticity of these tests. And since they have not been approved by either the WHO or the NCDC, the advice is caveat emptor. Do not rely on them and do not use them for making clinical judgment calls. The work is ongoing. I know there are scientists working around the world. They're working 24 hours. They're working collectively. They're working together. They're working in laboratories, because the thing that will make a major difference in containing and managing the COVID pandemic will be access to rapid tests. That will make a major, major difference. But what is available now, caveat emptor. Neither the WHO nor the NCDC have approved these tests for use. Their usefulness has not been proven yet, but the work is ongoing.
Bias beware. I was really chuckled when you said that, but I also want to talk about another form of testing. I think in the UK, the NHS was saying that as this advances, they're going to be doing what they call antibody tests, even though those that might have caught it, might have fought it, that might have been better in society without even knowing. Is that in the horizon for Nigeria? And I also want to talk about availability of reagents for the molecular test. And I also want to quickly ask you, what's your reaction? I hear we've ramped up the number of labs for those molecular testings, about 6 in Nigeria now. What's your reaction to those 3 points I raised?
The first thing is that, yes, the use of antibody testing is one of the research arms that is ongoing, because certainly if we can pick up, if we can test for antibodies, we use it for many other diseases to test whether you've been exposed to the disease or whether you do have the disease. I'm not an immunologist, I don't pretend to be, wasn't my favorite subject in school, but it is a research arm that I know is definitely ongoing. Also the use of other markers in the blood, and I heard this morning about a simple saliva test that is being developed that would be available or would be very useful in being able to do the rapid testing. However, this is all research that is ongoing. As at right now, we don't have the answers right now. So the molecular testing that we're doing now, which is the reverse transcriptase PCR, is slow. And the number of samples that have been taken, still waiting to be tested, is increasing by the day. There is no faster way to do this. It's a bit like getting pregnant. No matter how rich you are, the pregnancy is going to be 9 months, and then you see the baby. So it's a bit like that. And because it's a molecular test, it has a process that it has to go through. There's nothing we can do about that. Nobody's hiding information. It is not being restricted only to the so-called high and mighty. However, it is being restricted to those who have a very, very high index of suspicion that what they have is the coronavirus, and the test can then be applied so that we can monitor and use it to do the line listing and contact tracing of other people who they may have come into contact with. So yes, it is restricted, but not to the high and mighty as has been alleged.
Well, the NCDC is doing a lot, as well as other health practitioners and professionals who are on the front lines of this. But in specific terms, I'm not sure we have seen those specific outlines or protocols for pregnant women should they have coronavirus. If you were to advise or suggest to the NCDC at this time, what would that be? What should we do? I don't know if we're lumping all patients together. I don't know what's the protocol and what should the protocol be. But in your professional advice to the NCDC, what should this be for pregnant women?
Now that you've mentioned it, I believe something will be put together. There are protocols that we're leveraging on from other parts of the world where they're a little bit faster than we are in developing these protocols. But this is a very simple protocol for pregnant women, and it's still going to be what we advise the general public to do, because like we said, they are neither more at risk nor less at risk from any other member of the community. So they have to apply the same protocols as we would give to all members of the community, of all members of the public. And that is the social distancing, and that is the hand washing and use of an alcohol sanitizer. Don't touch public things that are likely to have been touched by others, door handles, stair rails and whatnot. Clean and sanitize as often as you can. Keep away from people who are coughing or exhibiting symptoms. The extra thing I would add for pregnant women, talk to your care providers. Please establish a connection now with them if you haven't done so already. But I believe a lot of pregnant women usually do have that connection with their care providers. And just keep going through your birth plan in the light of what the government is saying as per movement restrictions and lockdowns. Make sure if you have a birth plan that was going to take you across state, for instance, maybe you need to readjust that and talk to other members of your family, of your community, to see what other plans can be put in place.
A quick question as regards that. How will the antenatal care function in a time like this? Will it have to be done remotely, or is there a way to limit those hospital visits? And secondly, after the Italian case was treated, we got some antibodies from him. I'm not an immunologist anyway, like you said, but the truth is, we know that the antibody treatment has been in existence in medicine since the 1800s. Is there any ray of hope as regards that for treatment in Nigeria?
I think we will have to direct that question to the scientists. But I do know that it's one of the research arms that is going on, and they're working on it very assiduously, not the only one. But like I said, I will not dabble into areas that I confess I have little or no knowledge.
Okay, like I said, antenatal care this season, antenatal care.
Okay, yes, most and generally we would say that. I know that in Luth, where I work, we have reduced greatly the number of face-to-face contacts that mothers need to come in and get. If they're in their first trimester of pregnancy, it's been reduced to at least one. But most of these are usually dealt with on a case-by-case basis. If the mother is generally healthy and we feel that she can handle, she will do well with it, we just use the focused antenatal care protocol, a minimum of 4 visits, and we just work with the mother to find out what is suitable and what can be done. Where more urgent care is needed, of course, she'll be talking to her care team. And usually, I would be reluctant to put out a general umbrella recommendation, because at the end of the day, each woman, each child is unique and individual in the way they present, and the trust has to be between the pregnant mother and her healthcare provider. And therefore, whatever trusted protocol that they have chosen to use, which depends on the science, is a good strategy.
And that's a good place to leave it, Dr. Ann Roberts. Thank you so much for coming on the morning show this morning. We do appreciate your presence.